Hi friends, this is a journey of a middle-aged lady who had come to us with severe deformity of the leg. She had bow leg deformity in which the gap between knees increases and it becomes very difficult for the patient to walk. When she presented to us, she had a lot of pain in climbing stairs. It was a task to even walk few steps and her quality of life was severely deteriorated. We got all her X-ray evaluations and imaging done, and the evaluation revealed severe osteoarthritis of both knees with bone defects and varus deformity, which means there was bowing of the legs and there was significant bone loss. We did technology assisted robotic augmented reality knee replacement, and we were able to correct her alignment to neutral and were restored her balance of both her knees using technology. Within 24 hours of surgery, she was able to walk with a walker. Within 48 hours, she was climbing stairs and was easily mobilizing independently. She came to us for follow-up after a week and then 2 weeks, walking independently, having a restored alignment and a new confidence. She went on to have uneventful recovery with full knee movements and painless mobility. Her stitches were removed at 2 to 3 weeks follow-up and the wound healed beautifully. This is an example of how a transformation can happen with knee replacement and how a quality of life can improve.